Welcome to OET Answers.
Your preparation time is over. Now, you can start your speaking role play. Don't worry if I stop you when the time is up.
Good morning, Patricia. I hope you're feeling better today. I'm here to confirm that your wound dressing has been completed successfully, and you'll be discharged soon. How are you feeling about heading home?
Good morning, nurse. I'm feeling relieved. It's been a bit stressful in the hospital, so going home means I can finally relax and recover in my own space. I've been looking forward to it.
That's completely understandable. Hospitals are necessary for care, but there's nothing like the comfort of being home. Your recovery will likely be smoother in your own environment. Plus, being surrounded by familiar things can positively impact your mood and overall healing.
Absolutely. I think just being at home will make me feel more at ease, and I won't be as anxious as I've been here.
Exactly. Feeling relaxed plays a huge part in healing. That being said, it's really important to ensure your wound doesn't get infected. Let's start by discussing some infection risks. Burns can sometimes lead to complications, and the most common is infection.
Oh, I see. I didn't realize that burns could be so dangerous even after they start healing.
Yes, that's right. The risk of infection goes up if bacteria manage to enter the burn wound, especially when the burn is more severe. You see, the skin serves as your body's first line of defense, and when it's damaged, it's more exposed to potential threats.
I didn't know burns were so prone to infection. How would I know if something's wrong?
It's good to be concerned, but don't worry, I'm going to walk you through everything you need to know. Infections can slow down the healing process and make the burn more painful. In some rare cases, infections can even lead to serious complications like blood poisoning or toxic shock, which can be life-threatening if left untreated. That's why it's so important to follow proper care steps to prevent infection. Doing this will ensure your wound heals faster and with less scarring.
I want to do everything right. How can I prevent an infection?
That's a great question, Patricia. To prevent infection, there are a few important steps you'll need to follow. First, apply topical antibacterial treatments. These help slow bacterial growth on the wound. Maintaining good hygiene is crucial. Always disinfect your hands before touching the wound or changing your dressing. Wash the burn gently with mild soap and lukewarm water to keep the area clean.
I'll definitely make sure to keep everything clean. I know hygiene is really important.
That's right. It's one of the best ways to prevent infection. You'll also want to cover the burn with sterile gauze. But be careful not to wrap the dressing too tightly, as it could restrict blood circulation and slow down the healing process.
I didn't know that. I'll make sure the dressing isn't too tight.
Good. One more thing, healing burns can be painful, so you've been prescribed morphine. Take it about 30 minutes before changing your dressing during the first few days to help manage the pain.
That's helpful. Should I be taking antibiotics as a precaution?
It's understandable to think that way, but antibiotics aren't necessary unless there's already an infection or if the healing process is delayed. They are not needed as a precautionary measure in your case.
Got it. So I won't need them unless there's an infection. Is there anything else I should do?
Yes. For the first 24 hours after you get home, keep your hand elevated above heart level to reduce swelling. You'll also need to do passive joint exercises to avoid stiffness in your hand. Burns can sometimes cause stiffness, so gentle exercises will help maintain flexibility.
That sounds helpful. I'll make sure to follow those steps.
You're doing great. Once you're in the post-acute phase, massaging your arm 3 times a day will improve blood circulation and help prevent stiffness. Does that all make sense?
Yes, it does. I'll follow your advice. Thank you for explaining everything so clearly, nurse.
You're very welcome, Patricia. I want to mention one more thing. Recognizing the signs of infection early is key. Watch for changes in the color or amount of drainage from the wound, any swelling, redness, increased pain, or if you develop a fever lasting more than 2 days. If you lose your appetite or aren't drinking as much as usual, those can also be signs of infection.
That's a lot of signs, but I'll keep an eye out. If I notice anything, I'll call right away.
That's exactly the right approach. If anything doesn't seem right, it's better to reach out sooner rather than later. The doctor will be by shortly to do a final check and provide your discharge summary. Your medications should be ready in about 30 minutes.
That works for me. I'll wait for the doctor's final check.
Excellent. Before you go, do you have any other questions or concerns about your care at home?
No, nurse. You've covered everything, and I feel confident about taking care of my wound.
I'm really glad to hear that. You're well prepared. Just remember, if anything comes up later or if you're unsure about anything, don't hesitate to call us. We're here for you every step of the way.
Thank you so much, nurse. I really appreciate all your help. You've been amazing.
You're very welcome, Patricia. It's been a pleasure helping you. I wish you a smooth and speedy recovery. Take care, and don't hesitate to reach out if you need us.
That is the end of your speaking role play. All the best.
Thank you.
Thank you for watching. Please like and subscribe for more videos like this. Kindly comment your suggestions and help us to do better.